Welcome to today's expert talk, Rare Diseases, Data Make the Invisible Visible. We will discuss today how insights gained from data can transform the fight against rare diseases and help not only to better understand the actual diseases, but also the patient's needs.
Well, the knowledge about the diseases, the knowledge about how to treat the diseases, the diagnostics is the big problem. So normally a patient waits about 4 years until he gets a diagnosis for his disease. And you can imagine what it means for families who are affected with such a disease to not know for 4 years what the child or what the person has.
And we are talking about a rare disease when 5 in 10,000 are affected, or even less, 5 in 100,000 or 5 in a million. And this makes it so difficult to identify, to find those patients, and 95% of these patients don't have a therapy. So the more data we collect and the more we understand, the easier it will become to also to find new therapies for these 95 patients.
If you think about health research nowadays, it's a lot about data. Yeah? Data is essential for the new technologies, for AI, for the new models, for machine learning, all the things you need in order to treat patients, to stratify patients. And I think what you said is really important. And rare diseases are rare, but even the more common diseases, if we stratify into certain subgroups, yeah, then the subgroups do also not consist of that many patients. Yeah? So I think this will be a concept that will be even more important in the future. And for all this, we need data.
And collecting data helps us, on the one hand, to better understand the disease itself, how to diagnose it, also to find subset of different patients, how we can monitor the disease and setting treatment targets. And that's why it's so important to have all this data and that we are starting to collect this data as the patient benefits most at the end of the day.
How do you basically get the patients, given that the limited number of patients in one country, especially in Austria, I suppose it is really hard to find patients. I suppose you have to globally recruit them.
That's a very important question, as when it comes to the design of a clinical study, there is not so much difference in the requirements in a rare or a non-rare disease. You have the same requirements in terms of the statistics and sample sizes, so on and so forth. So you have, on the other hand, the challenge to find those patients, as you need to have a certain number of patients, as you said, Professor Stamm, that you can compare the efficacy of a treatment. And therefore, we need to understand the networks. And one source of networks are patient organizations. As they understand the disease, they have contacts to their patients. And then we have to have networks to experts in the clinics and doing the science.
Basically, we've just heard about policy changes. What policy changes do you believe are most urgently needed to improve the situation for people living with rare diseases?
Policies. I think some of these issues can only be solved on European level because otherwise you don't get the enough patient data all over Europe.
Mm-hmm. We've today explored how data revolutionizes the research of rare diseases and emphasized the crucial role of patient engagement. Patients are not just subjects of the research, but active partners as their voices shape better treatments. Thank you to all of you for joining this important conversation.